Hello everyone, I am myself Dr. Rajesh Gubba. I am the General Medicine Educator. In this session, I'll be doing a quick recap on the topic of the hypoparathyroidism. So you need to know what is the most common cause of the hypoparathyroidism. It is secondary to surgical removal of the thyroid gland. See, it is exactly behind the thyroid gland you have the presence of the parathyroid glands. So if there is any goiter of thyroid, right, so you will do surgical removal of that particular goiter, and whenever you are doing the surgical removal of the goiter, there can be removal of even parathyroid glands resulting in hypoparathyroidism. And what are the other causes of the hypoparathyroidism? The other causes of hypoparathyroidism, we have an hereditary hypothyroidism, and that is called as the Digeot syndrome. That is one of the important etiology which will cause hypoparathyroidism. And acquired causes, just now we have discussed, that is surgical removal of thyroid gland, and then the hypomagnesemia. See, magnesium is very much required for the release of parathormone from the parathyroid gland. Right, magnesium is very much required for the release of parathormone from parathyroid gland, and if magnesium is not there, parathormone is not released from the parathyroid gland. Next, now, so how does hypomagnesemia cause hypoparathyroidism? So as just now I have said, magnesium deficiency prevents the release of parathormone from the parathyroid gland. Next, now, hypomagnesemia, why does it occur? Hypomagnesemia can occur secondary to alcoholism, and as well as it can be due to decreased gastrointestinal absorption. These will be the etiologies which will cause the hypomagnesemia. Then, followed by that, what will be the clinical manifestations of hypoparathyroidism? See, in patients with hypoparathyroidism, they will develop what is called the hypocalcemia. Right? They will develop hypocalcemia. So whenever there is hypocalcemia, you need to know from when, or the duration of hypocalcemia is also very important, and you need to know the level of the calcium. Severe hypocalcemia, you will have different manifestations, and you also need to know the age at the onset of the disease. Now let me discuss accordingly. So you take the neurological manifestations. What are the neurological manifestations in hypoparathyroidism? See, in hypoparathyroidism, there will be hypocalcemia. And whenever there is hypocalcemia, you will have neurological manifestations. And these neurological manifestations include the neuromuscular irritability. And that includes tetany, laryngospasm, cramping, seizures, and impaired memory function. So these are the features of the neuromuscular irritability. Then hypocalcemia frequently causes circumoral tingling, and not only that, there will be also tingling of the extremities. Right, there will be tingling within the hands and as well as the feet. Right, tingling within the hand and as well as the feet. Now, you need to know the Chostek sign. What is Chostek sign? You will see that in patients with the latent tetany. That is, what you need to do is, you need to tap over the angle of mandible. So once you tap over the angle of the mandible, you will have the contraction of the facial muscles and as well as the upper lip on that particular side. That is called as the Chostek sign. Next, you need to know what is the Trocheus sign. So what is this Trocheus sign? It is like you need to apply the BP cuff and you need to inflate the blood pressure within the cuff. And how much you need to inflate is, you need to inflate above the systolic blood pressure, and you need to place the cuff above the systolic blood pressure for nearly around 3 minutes. And what is that you will notice, or what is that you will observe? You will observe the flexion of metacarpophalangeal joints. Right, you will observe the flexion of the metacarpophalangeal joints, and you will observe the extension of the interphalangeal joints. Right, you will observe the extension of the interphalangeal joints. That is what is called as the Trocheus sign. Okay, next, and you see this in hypoparathyroidism. Next important thing is, you need to know what are the ocular manifestations in hypoparathyroidism. See, ocular manifestations will be in the form of cataract and soft tissue calcification. Followed by that, what are the ECG manifestations in hypoparathyroidism? ECG manifestations in hypoparathyroidism is QT prolongation. And why is that you have that QT prolongation? That is because of hypocalcemia, you will have QT prolongation. And how much is the normal QT interval? Normal QT interval is 360 to 440 milliseconds. But in these individuals, because of hypocalcemia, you will have the presence of the QT prolongation, right? So that will be more than 440 milliseconds. And another important cardiovascular effects of hypoparathyroidism is these individuals, they can have refractory congestive heart failure or the hypotension. So this will be the ECG manifestations and cardiovascular manifestations in hypoparathyroidism. Now, what is the effect of the hyperventilation on hypocalcemia? Let me tell you, hyperventilation will worsen the hypocalcemia because whenever there is hyperventilation, the carbon dioxide is washed out, and that will make the individual to develop the respiratory alkalosis. And this respiratory alkalosis decreases the free calcium, right? This respiratory alkalosis will decrease the free calcium, and thereby the tetany will be appearing whenever the individual does the hyperventilation. So the effect of hyperventilation on hypocalcemia is it will worsen the symptoms of hypocalcemia. Okay, next. Now, how do you diagnose hypoparathyroidism? So very important thing is the serum calcium levels. How much is the normal serum calcium levels? That is around 9 to 11 milligrams per deciliter. But in patients with hypoparathyroidism, the serum calcium levels are low. And always, whenever you are measuring the serum calcium levels, you need to measure the albumin and make the correction in the calcium levels. So how do you do calcium correction in hypoalbuminemia? Please remember this. A low calcium may be due to low albumin, right? A low calcium may be due to low albumin. So please remember, for 1 gram per deciliter drop in albumin, the total calcium will decrease by 0.8 milligrams per deciliter, right? The total calcium will decrease by 0.8 milligrams per deciliter. So that is what is your calcium correction in hypoalbuminemia, right? Next. Now, followed by that, what are the conditions with low calcium and high phosphorus? You will have that in patients with the hypoparathyroidism. So in hypoparathyroidism, you will have low calcium and high phosphorus. And you will also have that in patients with renal failure, because whenever there is renal failure, the vitamin D is not synthesized and calcium absorption from the intestines does not occur, and that will make the individual to have low calcium. And whenever there is renal failure, the phosphate is not excreted out, resulting in hyperphosphatemia. And whenever there is massive tissue destruction, even then also you'll have the presence of the low calcium and high phosphorus. And hypoparathyroidism, you will have low calcium and high phosphorus. Why? Because when parathormone is not there, bone resorption does not occur, and that is the reason why they'll have low calcium. And second important thing is, when parathormone is not there, please remember, parathormone will cause the excretion of phosphate. It will inhibit the phosphate reabsorption at the level of the renal tubules, and your parathormone is not there. So phosphorus reabsorption will occur in the renal tubules, and thereby there will be high phosphorus. Okay. And lastly, in pseudo-hypoparathyroidism, you will have low calcium and high phosphorus. In pseudo-hypoparathyroidism, parathormone is present in adequate quantities, but the receptors for parathormone are resistant in pseudo-hypoparathyroidism. So please remember, where do you have low calcium and high phosphorus? That is in all these scenarios. Next. Now, what are the conditions with low calcium and low phosphorus? See, low calcium and low phosphorus is due to absent or ineffective vitamin D, right? Are due to absent or ineffective vitamin D. Next, how do you manage hypoparathyroidism? See, the treatment of hypoparathyroidism is that basically the clinical features are mainly because of hypocalcemia. So in acute stages of hypocalcemia, you need to give intravenous calcium gluconate, right? In the acute stages of hypocalcemia, you need to give intravenous calcium gluconate. And what is the maintenance therapy in hypoparathyroidism? Maintenance therapy is that you need to give oral calcium or vitamin D has to be given. So maintenance therapy in hypoparathyroidism is oral calcium supplementation, and as well as the vitamin D has to be supplemented. And if there is hyperphosphatemia, then dietary restriction of the phosphate, or you need to give the phosphate binders. And what are these phosphate binders? That includes calcium carbonate or aluminium hydroxide. That is the maintenance therapy in hypoparathyroidism, right? Next, a very important clinical recall. Which of the following is a clear indication for surgery in a patient with primary hyperparathyroidism? Calcium level 10.5, creatinine level 1, ECG showing prolonged QT interval, male gender age 38 years, DEXA scan showing T-score of plus 1.0. So the indication is, the answer is D. Please remember that it's an important question. So this completes the discussion of hypoparathyroidism. Thank you very much.